Invasive strep cases, they continue to skyrocket in children across the country. So what's causing this recent spike? Dr. Mike is here.
Yeah, it seems like everyone's sick. All the schools flooded, everybody's sick. Everyone's got all this coughing and everything else happening.
Right. Yeah, it's true. Everybody is sick, folks. And the bottom line is that we're seeing it especially in young children. Now, you mentioned, Alex, invasive strep. What we're talking about is old-fashioned strep that can sometimes be associated with invasive strep. So invasive strep is where it can get into the bloodstream and cause even death.
Oof.
Routine, old-fashioned strep throat, this is the time of year that people get it. What's interesting about this year, numbers are way up and the symptoms are a wee bit different. So kids can just have sniffles, some congestion, low-grade fever. Typically, what I see with patients that have strep throat, they have a very gnarly throat. They have what's called exudate, white spots in the back. Very high fever, swollen lymph nodes. They feel terrible. It's a very violent bacteria. The key here, though, is you need to get checked out because if you have it, even with mild symptoms, it needs to be treated with antibiotics so you don't have complications like rheumatic fever. You can have heart damage. Back in the day before antibiotics, that was a common thing with strep.
Also, when we're talking about traffic, and we do it every morning, and we also have some traffic issues happening this morning, no one likes it, right? But there might be medical reasons why we shouldn't like sitting in traffic and having to deal with that. It affects our blood pressure?
Well, I'm more concerned about people living right next to a highway because what happens is that sound, the loud noise, in probably the largest study ever done, 250,000 people, they found an increase in blood pressure. And to make matters worse, if you have all those diesel trucks going by, and we've talked about this before, the exhaust contains these little microparticles that can actually get into the body, and that can lead to problems like high blood pressure. So I think when it comes to planning from now on, we're going to have to really make sure that those barriers go up.
The noise dividers.
Right,
yes.
right.
I'm fascinated by this one. The shape of our hearts, and I didn't even know there were different shapes, but it could be a predictor of later heart attacks or cardiac arrest.
Yeah, fascinating. I love it. Now here you go. Look at this. So hearts can take different shapes, and even if you are completely normal in terms of your EKG and everything else, using artificial intelligence, they're finding that, see the picture to the right? It's a little rounded. That can be associated with genetic problems and down the road something called cardiomyopathy. That's where you have an enlarged heart. And so using artificial intelligence and going through all of this imaging that we have, we might be able to predict early on whether someone is going to develop a problem or not.
So what's the normal shape? Like, what is a heart supposed to look like?
Can we get that picture back in the center? That's what it looks. I don't know if we can get. There you go.
So it's like an apple
right?
or something.
But they're all normal functioning hearts in that
they
picture.
look similar to me.
No.
Right, but the bottom line is here's one. Look, I brought a heart. Right here.
That's what it's supposed to look
like. There you go.
Right?
It's a nice heart.
Yeah.
Just like the two of you. You have a nice, beautiful heart, just like that. And so what happens is people will have more of a rounded shape. Sometimes it's more elongated. But when it comes down to it, this artificial intelligence may provide a lot of information.
Okay.
Exciting time to be in science and medicine. If you're out there, listen, if you're a young person and you're interested in science, we need you. We, like Uncle Sam, we need you because I'm getting old. A lot of people getting old.
No, you're not going anywhere, though.
I'm an old dog.
Oh, please.
No, I'm getting old. I want young bucks taken care of. I want young people.
Okay.
All right.
Thank you
Smart.
for that recruitment video.
Love
I appreciate it.
Love you.
Love you.
Love you.
We heart you. Thanks, Dr. Mike.